I mean, like I said, Mother Nature designed us, right, not to be rodents and only living in the dark, or bats living in the dark, but rather to be hunter-gatherers, to be out exposed to sunlight every day. Um, and I think that another good example that I often mention to my colleagues is that we know from Bruce Hollis, Carol Wagner's work, that, and from our own work as well, is that there's essentially no vitamin D in human breast milk, right? And the American Academy of Pediatrics recognizes this now, and the Endocrine Society, of course, did as well. And we recommend that lactating women need to give their infants vitamin D supplementation as soon as possible, at least 400 units a day, up to 1,000 units based on Endocrine Society practice guidelines, considered to be perfectly safe. But if you think about this, this makes no sense from an evolution perspective. Why would human breast milk not have enough vitamin D? And so Bruce Hollis and Carol Wagner did the study, and they asked the question, what if you give lactating women more vitamin D? Maybe they'll actually put it in their milk to satisfy their infant's requirement. And they showed that if you give lactating women about 6,400 units of vitamin D a day, they finally put enough vitamin D in their milk to satisfy their infant's requirement. And this now makes, again, evolutionary sense. We talked about the Maasai herders having blood levels of 40 to 60 nanograms per ml, and that they would require taking 4,000 to 6,000 units a day, right? It's the same thing. A lactating woman outside every day would be making about 4,000 to 6,000 units of vitamin D a day, and therefore satisfying their infant's requirement. So we think that throughout evolution, that sunlight has played a very, very important role. And I think that, you know, the story of rickets, which I think everybody's aware of, I mean, in Glasgow, Scotland, I mean, it was devastating. I mean, probably more than 90% of these children had growth retardation, severe skeletal abnormalities, severe bone pain, and disabilities. At the turn of the last century, even in Boston, it was estimated that 80% infants had rickets because, again, coal burning was obviously the best way to have energy. The pall of smoke from above, buildings in close proximity, children not being exposed to any sunlight, had severe rickets. And it was Hess and Unger, 1921, who finally realized, after a lot of other studies beforehand, that if you expose children to a roof on the New York City hospital to sunlight, it could cure their rickets and prevent rickets. And so we've known for a very long time the important role of sunlight and vitamin D. We and others have shown that the most common, the most serious complication of pregnancy is preeclampsia, and that vitamin D deficiency increases risk. We also did a study at our hospital of over 200 women and asked a question. Since vitamin D is critically important for muscle function, which is important for the birthing action, does vitamin D deficiency potentially increase risk of requiring a C-section? And we showed that it did, that those women that were vitamin D sufficient had less likelihood of requiring a cesarean section. We also know that in utero, that vitamin D deficiency is playing a role for the infant's health because they're at increased risk for wheezing disorders, asthma, as well as dental caries. If you live above Atlanta, Georgia for the first 10 years of your life, and then if you live down at the equator the rest of your life, you still have a 10-fold increased risk of acquiring multiple sclerosis. And there's data out of Harvard to show women had the highest blood level of 25-hydroxy-D at the lowest risk of multiple sclerosis. Another study that was done by Happonen many, many years ago showed that infants back in Finland, back in the 1960s, were getting 2,000 units of vitamin D a day. And then they followed them for 31 years and showed that those that were on 2,000 units of vitamin D a day reduced risk of type 1 diabetes by 88%. And then all of a sudden the experts said, wait a second, you can't give an infant 2,000 units of vitamin D a day. That's toxic. And so as a result, they started decreasing the intake. And Cedric Garland showed many years ago that you see now a marked rise in the increase of type 1 diabetes in Finland, all possibly in part because of the decrease in vitamin D intake. So we do think that autoimmune disorders indeed are associated with vitamin D deficiency. And as I mentioned early in the program, we had done a study and asked a question. And that is, if you take a healthy adult that's vitamin D deficient or insufficient in the wintertime in Boston and give them either 400 or 2,000 units a day, and then look at their white blood cells and their gene expression at the beginning and 3 months later, we initially showed that several hundred genes were being influenced. So then we asked the next question, which was, what if you continued to increase your vitamin D intake? Would it continue to have an effect on your immune system? So we did another study, and what we did was we gave 600, 4,000, or 10,000 units a day to healthy vitamin D deficient, insufficient adults, and got their blood level at the beginning and at the end, looked at their white blood cells, and looked at what genes are being expressed. What was really remarkable, on 600 units a day, a little over 150 genes were actually being affected. So even a tiny amount of vitamin D is having an effect. 4,000 units a day, about 300 genes. On 10,000 units a day, more than 1,200 genes were being affected. And these genes control apoptosis, which plays a role in reducing risk for cancer, effects on your immune system, on DNA repair, and on a variety of other metabolic processes. So we do believe that vitamin D has a very important role to play on your immune system.